Imagine yourself standing in the dying embers of a Neolithic village. The firelight flickers, casting warped shadows on the faces that circle you, faces etched with fear, hope, and desperation. Before you lies a young man, pale and contorted, his body racked by uncontrollable convulsions. His eyes flutter wildly, glazed and unseeing. Foam rolls from his trembling lips. The whispers ripple through the crowd like a chilling wind. A spirit has taken hold of him. No potion can quell this madness. No charm will chase away the evil. Only one option remains. You are the healer, or perhaps the priest, the last beacon between life and the abyss. You grip an obsidian blade, black, razor sharp, deadly. Your hands shake as you press the blade against his scalp. No anesthesia can dull the agony. No sterile tools shield you or the patient from infection. You begin to scrape, to bore, to carve into his skull. This was not a frenzy born from ignorance. It was trepanation, one of the oldest, most horrifying surgical procedures in all of human history. Trepanning, or trepanation, is the deliberate act of making a hole in the skull by scraping, cutting, or drilling. It is the earliest recorded form of brain surgery, with archaeological evidence indicating its practice dating back at least 7,000 years. The reasons for such a gruesome operation were never simple. Some believed it released evil spirits, others saw it as a way to treat physical injuries, seizures, or mental illnesses. Yet how could ancient peoples without modern medical knowledge dare perform such an operation? And more bewildering, why do we find evidence of it practiced independently all over the world? The geographic breadth of trepanation is staggering. Around the Andes Mountains in Peru, countless skulls display evidence of precise trepanation, and astonishingly, many show signs of healing, suggesting not only the survivability of the operation but the presence of skilled practitioners. Some skulls bear multiple holes, indicating repeated surgeries over the lifetime of the individual, an ancient form of neurosurgery, with implied knowledge passed from generation to generation. In prehistoric France, Neolithic skulls with trepanation date back 5,000 to 7,000 years and are found in surprisingly high frequencies, up to 40% in some burial sites. Here too, some of the skulls belong to children, exposing the harrowing reality that even the youngest underwent this brutal ritual. Across Africa and the islands of Polynesia, similar practices existed. Local materials such as sharpened seashells and flint tools served as surgical instruments. Spirits and religious rites enveloped the practice with mystical significance. Ancient Chinese medical texts mention skull surgeries that mirror the trepanation known from archaeological findings elsewhere, linking the practice to relief from headaches and madness. These cultures, ostensibly disconnected, demonstrate a shared primal urge to combat the afflictions of the mind and body by breaching the skull, both a literal and symbolic opening to healing. To us, piercing the skull might seem barbaric or even insane, but to our ancient ancestors, mental and neurological afflictions were terrifyingly real and entwined with the spiritual world. Seizures, epilepsy, sudden madness, and chronic head pain were symptoms of a body and mind possessed or tortured by evil spirits. The skull was a prison for these malignant forces. The channel of escape was a hole, a surgical portal carved with stone into the vault protecting the brain. This was a desperate, hopeful act to release the spirit, free the patient's soul. Such thought was neither mindless nor cruel. It was rigor born of fear, belief, and compassion. No surgeon's gloves, no anesthesia, no sterile fields. Instead, healing was attempted with slices of volcanic obsidian, flint blades chipped to surgical edges, rudimentary copper or bronze trephines, or sharpened bones fashioned to cut through the hardest human tissue. Techniques varied by region and culture, scraping, layer by layer, scraping until a hole was revealed, drilling, slowly boring circular or oval grooves to weaken the bone, cutting, removing pieces by cutting square or triangular sections. The process was agonizing, fraught with danger. Too deep and brain tissue could be damaged fatally. Too shallow and the procedure failed. Every scrape, chip, or drill required skill and fortune. Imagine a chant rising in the night, the rasp of stone against bone, the smell of warm blood mixing with sweat and fear. Against all odds, many patients survived. The proof lies in the stone and bone themselves. Skulls from Peru bear traces of bone remodeling around trepanation sites, demonstrating survival that could last years. The Inca surgeons recorded high success rates. Some estimates suggest up to 70% survival. In European necropolises of the Neolithic era, trepanned skulls show healed margins, revealing the patients endured this procedure from childhood to adulthood. Some skulls even display multiple trepanations, patiently re-entered openings, the patient returning repeatedly to the healer's care. Each scar on bone adds a chapter to our understanding, not only painful ordeal, but remarkable endurance and knowledge. Among the archaeological discoveries at Cusco, Peru, lies a skull belonging to a warrior who survived multiple trepanations following battle injuries. The clean circular holes indicate a surgeon who understood vascular anatomy, cutting around critical vessels to avoid fatal hemorrhage. This skull bears witness to neurosurgical knowledge and ritual seriousness, woven into a culture where life was a precarious gift. Was that hole a last-ditch medical intervention, a spiritual act, or both entwined? Picture it. A body stretched rigid on a wooden slab, limbs bound tight, the air thick with smoke and whispered prayers. The obsidian blade, slick and gleaming with honey, used as a primitive antiseptic, is pressed deliberately to scalp. Scraping begins. Thin flakes of bone fall, the rasping sound a sickening grind. Blood wells freely, a river of life and death. Hands hold tight, the patient gasps and screams, trapped between agony and hope. Once the bone breaks free, an opening appears, a gateway open to the gods, spirits, and perhaps mercy. Without anesthesia or modern medicine, post-surgical pain was horrific. Infections were common, brain swelling dangerous, yet natural remedies occasionally soothed. Honey's antibacterial properties, herbal poultices soaked in medicinal plants, vigilant care. Listeners whisper prayers into the night, watching over the fragile lives who survived the blade. Life with a hole in the head was no promise of healing, but a balance struck on the razor's edge. As centuries unfolded, trepanation did not vanish. It evolved. In the classical world, medical writers Hippocrates and Galen described similar procedures, carefully outlining trepanation techniques to treat head wounds and fractures. Medieval European physicians believed madness, epilepsy, and other maladies arose from imbalances of humors or trapped evil. Trepanation and skull drilling became common treatments, mixing medical theory with superstition. In Renaissance courts, some high-ranking nobles endured dozens of trepanations in attempts to relieve brain pressure or cleanse the mind. These repeated surgeries bear grim witness to desperation and hope mingled in equal measure. Ancient and medieval surgeons learned to skirt death by mastering trepanation's delicate balance, cutting deep enough to relieve pressure but not deep enough to damage dura mater or cause fatal hemorrhage. In Peru, the sharp contrast between flint blades and copper tools mirrors their quest for better precision. Some rituals demanded trepanation near temples or sacred sites, imbuing the operation with spiritual weight. The surgeon's hands became fragile instruments, part scalpel, part conduit between the living and the spirit world. As the centuries unfolded, trepanation did not vanish into the dusty pages of forgotten history. Instead, it evolved, weaving itself into the complex tapestry of classical and medieval medicine, clinging stubbornly to belief and practice despite advances in understanding the human body. In the classical world, medical luminaries such as Hippocrates, often regarded as the father of medicine, outlined techniques remarkably akin to ancient trepanation. Hippocrates described in his texts methods to treat skull fractures and head injuries by boring holes into the skull to relieve pressure or remove shattered fragments. His writings reveal a cautious, methodical approach to surgery, aimed at reducing death by infection or trauma, in a world where death was a constant companion. Later, Galen, whose medical philosophies held sway for over a millennium, also documented cranial interventions, though often wrapped in the cultural and religious contexts of the time. Yet, as centuries marched on, the veil of superstition began to thicken around the practice. Medieval European physicians operated within a framework heavily influenced by the humoral theory, which posited that bodily health depended on balancing four fluids: blood, phlegm, black bile, and yellow bile. Madness, epilepsy, and other mental afflictions were believed to result from imbalances in these humors, or even as a manifestation of trapped evil spirits or demonic possession. The logic of trepanation shifted under these beliefs. Instead of a purely physical intervention, it became entwined with spiritual warfare. Thus, skull drilling and trepanation became common remedies to release bad humors or evil influences. The sharpness of metal trephines improved with technological advances, offering a swifter, sometimes more precise, surgical experience, though risk of fatal infection remained high. In the courts of Renaissance Europe, desperation met hope in the repeated use of trepanation by the nobility. Historical records recount individuals who underwent dozens of trepanations over months or years, each surgery a fragile hope to relieve swelling, madness, or humors poisoning the brain. The persistence of these repeated, invasive surgeries speaks volumes about the human will to live and the lengths to which families and physicians would go in the absence of effective treatments. Behind every trepanation stood a surgeon walking the razor's edge between healing and death. Ancient and medieval surgeons learned, often through tremendous trial and error, to cut deep enough to relieve intracranial pressure, but shallow enough to avoid piercing the dura mater, the tough membrane enveloping the brain, or causing fatal hemorrhages. In Peru, archaeological evidence reflects an evolution in surgical tools, from primitive flint blades to the sophisticated use of copper and bronze trephines. These metal tools allowed for more precise, safer cuts, though the surgeon's skill remained paramount. Trepanation was often performed in ritual contexts, near temples or sacred sites where the act was as much about spiritual cleansing as physical healing. The surgeon's hands thus wielded power, as scalpel, as priestly instrument, embodying the liminal space between life and death, the material and spirit worlds. Surgeons became custodians of both science and ritual, their mastery woven from knowledge, faith, and the screams of their patients. With the rise of modern medicine, ancient practices like trepanation were relegated to historical curiosities or outright dismissed as barbaric. Yet in the 1960s and 70s, amid the tides of psychedelic liberation and countercultural revolutions, a curious revival emerged. Fringe practitioners began advocating trepanation as a method for expanding human consciousness. Bart Hughes, a Dutch medical dropout, became the most prominent figure in this movement. Hughes theorized that drilling a hole in the skull increased cerebral blood volume and flow, purportedly allowing enhanced awareness and spiritual clarity. Calling it trepanation for consciousness, Hughes performed the operation on himself and inspired a small but dedicated following, despite warnings from mainstream medicine labeling it dangerously misguided. Today, a minority still pursue this practice, drawn by promises of enlightenment, a strange echo of ancient faith in the healing power of the human skull breached. Modern neurology reshapes our understanding of trepanation's effects. We now know that trauma-induced swelling or hematomas can cause deadly pressure inside the skull. In the absence of surgical intervention, fatal brain herniation often ensues. In this light, some ancient trepanations, particularly those following battle injuries, likely saved lives by relieving intracranial pressure. The unknowing surgeons, armed with bone scrapers and obsidian blades, were inadvertent pioneers in the field of neurosurgery. Yet, the majority of trepanations likely had ritual or spiritual aims, performed to exorcise unseen demons rather than address physical injury. These practices embodied humanity's attempt to marry the seen and unseen, the physical wound and the metaphysical affliction. Gaze upon the image of the healer scraping away bone to free a trapped soul. Is this act madness born of ignorance, or an expression of compassion and faith? The act crystallizes humanity's timeless, terrifying quest to understand the brain, the core of our identity, reason, and emotion. The scraping stone, the crackling firelight, the beating heart beneath the jagged edge, all evoke a primal struggle between pain, hope, and the mysteries of consciousness. Is this cruelty, or the fragile first flicker of science? Is the repetitive sound of stone rasping bone the echo of humanity's most profound defiance against death, spirit, and madness? Throughout history, the study of ancient trepanation remains shadowed by academic hesitation. Early psychiatric and neurological practices were stigmatized, dismissed as barbaric or madness. Researchers grapple with confronting this raw history, a mirror into humanity's earliest, most intimate struggles with mental illness and pain. Cultural shame often muffled discussion of surgical treatments for psychiatric disorders, shrouding trepanation in silence despite abundant physical evidence. It tells us that from the dawn of humanity, we sought to conquer suffering, mental, spiritual, physical, that in the face of incomprehensible terror, madness, convulsions, death, we turned to surgery, ritual, and faith. That the hole in the skull was more than a wound, it was a gateway, a testament to resilience, fear, and fragile hope. Imagine what other shadows of ancient history await. Deeds done in the name of love, war, the afterlife, horrors human hands have wrought across time. Click the next video to journey deeper into humanity's hidden past. Subscribe, and together We will keep peeling back the layers of time,